As the governor said, we have also are making a change in an order on how our hospitals are working. This is not an extensive change in order. We are still very much in the process of working with the hospitals and with all sorts of private providers out in the community. So that work is still ongoing. Similarly to business, we're looking at what are the lowest risk healthcare things we can be doing to the highest risk. And we'll be doing that in every industry as we gradually return and try to learn to live with the virus. But one of the things we've noticed, and it's very disturbing to me as a physician, it's very disturbing to the governor, to learn about situations in which, you know, there are people who have had some symptoms that I do not think are non-essential. It's really important that our clinicians reevaluate that, and to that extent, I'm putting some clarifications into an order. There are some people, we call this foregone care. There were people who are first in line to have some diagnostic procedures and some procedures that are really needed. It's been a while now, over a month, that we have postponed certain procedures for very vulnerable and complex situations, so we'll be addressing that in the order. But we have a lot more work we're doing in partnership with providers all over and with hospitals on how we'll be eventually doing more and more. But as a very slight tweak to the order we have done, we will be clarifying that order. It's really, really important. And if you're at home and if you're having a change in your clinical condition, please reach out to your doctor. And doctors, if you have questions about that guidance, please do reach out. You know, coronavirus.ohio.gov. We still have our hotline, always behind us on the screen. And I want you to use that and ask the questions you need to ask. I don't want anyone out there should not be suffering or having a worsening condition and not have that condition reevaluated. I really want to do a shout out to our federally qualified health centers. There are a number of free clinics in addition. People are really stepping up. If you are not finding care and you're out there, go to your emergency room if you have no other provider. Really, nobody should be left suffering. And I have just found a few stories I've heard of people being denied care, just unacceptable. So please, that is what my new order is about.